We were just at the playground and the dog just started attacking my friend's son.
At the Victorian Emergency Communications Centre, a frightened caller is on the line.
Is there any serious bleeding?
There is some bleeding.
And what part of the body was bitten?
On the side of the hip. Mum's saying that there's some flesh showing, so she's really scared to look.
All right, I'm just organising some help for you now.
Right at the log. He's coming in hot. Roger. You're good.
Mike and Eamon are being sent Code 1 lights and sirens to the 5-year-old boy.
Right, Focky. He's been attacked by a German Shepherd. The mum is stressed, plus. How terrible.
Dogs' jaws are incredibly strong. Like, we could be talking lacerations, bleeding, broken bones, because kids' bones, they're pretty soft. They will bend and break really easily under the force of a dog's jaw.
Bloody hell, a German Shepherd, that's a big dog. Yeah. He's going deaf, this bloke. Yeah, he is now.
Depending on the force of the bite from this dog, it could be life-ending, life-altering. It's going to be potential for huge injuries with this child.
I am really super excited for you because I think you will make an excellent paramedic.
Across town, Nat is congratulating Leonard on his new promotion.
So good news, I passed my Micah course, finished, done forever, and now I get to start on road.
Micahs are the elite paramedics of Ambulance Victoria, dealing with only the most serious cases.
I can't wait to one day be at a job with you as Mike and me as ALS.
I'm super proud of him to be fulfilling his dream. It's just amazing. I'm just thrilled for him.
It's a commitment, but it's a commitment I want to take. And you know me, when I do something, I'm going to do it well.
I do.
And I'm going to commit fully.
Sadly, today is one of the last shifts these paramedic buddies will spend together.
Nat might not want to admit it, but she's going to miss me when I'm gone. She just won't tell me to my face.
You will remember, though, that you started on an ALS truck, won't you?
I keep telling Leonard that he will definitely miss me. We have so much fun together. We laugh, we talk about everything.
You just remember where you started, OK?
And he needs to enjoy working with me while it lasts, because soon he'll be on a micro ambulance and there's just no one out there like me.
I know.
We just got sent to a female. She slipped over and it's query fractured leg.
So she slipped?
Yeah. Leg is twisted. Patient sitting at step of a shallow pool.
Anytime something comes through saying that the leg is twisted in the wrong direction, I think this is not going to be good.
She's actually on the 19th floor of a hotel.
Wow.
You can hear it.
Difficult extrication already.
Very difficult.
We're going to need stair chair for sure.
G'day. Obviously, you guys aren't doing too well.
As soon as we arrive on scene and I see the patient is still in the swimming pool, I just think this is going to be tough to get her out.
What's your name?
Michelle.
Michelle? Hi, my name's Leonard. What's your name, mate?
Nate.
Nate, are you Michelle's
Partner.
I'm probably going to need your help at some point in time. Michelle, how have you done what you've done? So have you walked up?
I was just walking from the second step and hit the side. I can't move it.
Yeah.
OK.
This poor lady, beautiful rooftop pool, she's got her bathers on, she's looking good, steps into the pool, bang, falls, breaks her leg. I mean, it's a nightmare scenario for her.
It might seem like a really silly question, but how bad's the pain?
Oh, my God. 10?
10?
10 out of 10.
Yeah, all right.
So the first thing we need to do is to get on top of Michelle's pain. She's in absolute agony.
I'm going to give you the green whistle. I don't know if you've used it or seen it before.
We can't splint the leg until she's comfortable, so we really need to give her as many analgesic medications as we can.
Breathe in through the mouth and out through the nose.
I can see the bone almost poking through the skin, and the leg just looks like it's on a completely wrong angle. It is a terrible fracture.
Now you can do it, you can do it. Keep it in your mouth.
300 metres.
Mike and Eamon are about to arrive at a kid's playground where a 5-year-old has been attacked by a German Shepherd.
There's a waiver or two over there. Yeah. Through this car park? Yeah. Hello.
The team is met by the little boy's distressed family and friends.
Do you know the young fella?
Yes, it's my friend's son.
He's your friend's son.
He's my brother.
He's your brother. What's your brother's name? Leo. Okay. Hello. My name's Eamon. I've got Mike. What's happened with Leo? Let's have a look, okay? Leo, you're okay, mate. Oh, he's got a good...
Leo is hysterical, and at this point, I don't know if he's hysterical from the pain or it's just the trauma of being ragdolled by this German Shepherd.
Yeah, right, mate.
We're just going to look at him. There's Mum. Hey, buddy. Great job, Leo. Got abrasion here.
Puncture wound there. Yeah. There's a fair bit of bite force in a German Shepherd, isn't there? Okay? I mean, it's okay, mate.
You're so brave.
All right. So what happened, Mum?
He's standing on the playground and I saw this kid screaming. I come in and then I saw the owner took the dog, but he's already by Leo.
Okay.
Mum tells us that she's heard Leo screaming and she's grabbed her child out of the mouth of this dog and then thought this dog away to protect her kid.
Was he crying straight away?
Yeah.
Has he been able to walk around at all? Did he run over to you at all?
Yeah.
Straight after?
I picked him from the ground.
You picked him up from the ground. Look, let's get him up and out of the public view. We'll get him over into the ambulance. You carry him, all right?
Without a full assessment, there's no way to know what's going on internally.
We don't know yet what that fang has potentially punctured inside his abdomen. A dog's mouth is a dirty place and we're penetrating the skin, so there's a huge risk of infection.
So the dog's lifted him up in the air?
The owner tried to keep him, but the dog's too big to control.
Yeah.
It's a harrowing story. It's a frightening story. It's one that I think any parent would shudder at the thought of.
Very scary, isn't it?
It was so first time.
I am so excited to go home to Perth.
I wish I was coming.
Oh, you'd love it.
It's the start of shift for besties Emily and Steve. With all of Emily's family in Perth, Steve's become her surrogate brother.
Emily is the most sweet, bubbly girl you will ever meet. We joke and say that we're soulmates.
How do you like your steak?
Medium rare, babe.
No, it must be well done.
I want to know that I'm eating actual steak. Oh, they're burning.
Oh my goodness. As soon as Steve and I met, it was just like, you are my person. We just connected on such a deep level really quickly. He just makes everybody around him feel so loved. He's just a really beautiful character.
I love Emily. She's always there for me. If I was straight, I would marry Emily.
Emergency services. Tell me exactly what happened.
My sister, she seems very confused. I wouldn't be surprised if she's had another stroke.
All right, I'm organising help for you now.
Okay, so we're going to a 83-year-old female querying stroke, and she had a stroke before 6 months ago.
She's 83, she's got all the risk factors. Let's hope for her sake it's not.
Almost 15,000 Victorians a year suffer a stroke. Brain cells die from the decreased blood flow and lack of oxygen.
This way, love. No.
All stroke patients are time critical, and today's city peak hour traffic is testing Emily and Steve's patience.
Move, my love.
Oh, I'm mounting curbs. It's extremely frustrating when you're on the way to a potentially life-threatening job and people won't move out of your way. Move.
Yes. I love that horn so much. Okay, so it's all the way at the end. I think the nuns live here.
Oh, it's a nunnery.
Yeah.
I love the nuns. They dedicate their life to their work, which I find very admirable, and I have a soft spot for the elderly. It's like the doctor saying you need one apple a day. For me, it's one nonna a day, or one grandma a day, or one yaya, and I am happy.
Hello, how you going? I'm Stephen, this is Emily.
Mary's
the patient. Hello.
Hello, Mary.
Already on the scene is a member of Ambulance Victoria's specialised stroke unit, Richard.
Mary was seen well last night.
Yep.
Today, her brother has had a chat to her. He noticed that she was confused more than normal.
Yep. Do you feel vague? Like you can't get out what you want to say properly?
I'm not able to.
Alarm bells are going off. Confusion is one of the main signs for a stroke, and if that is happening to Mary, it would honestly be absolutely devastating.
Mummy right here. Mummy right here.
It's okay. Mummy's going to be just behind you.
At a playground in Melbourne's southeast, 5-year-old Leo has been attacked by a German Shepherd.
All right. Hi, Leo.
Eamon and Mike need to calm down the traumatised little boy so they can investigate the extent of his injuries.
It's okay, Leo. It's okay. Let's take your top off. Show me how big your muscles are.
We know the bite force in a German Shepherd is huge. There's a reason that they're used in militaries and police forces around the world.
You are so good.
Once those dogs latch on, they are going to clamp down and not let go until someone forces that dog off the child.
What were you doing at the park? Were you playing on the swings?
No.
No? It's okay, Leo. Mummy's just behind you. Yeah.
It looks like just the one significant bite to the jacket, mate.
Yeah, I can see the puncture marks. Okay, we won't touch it. We won't touch it. We won't touch it, okay? That's all right.
Having a look at Leo's jacket, I can see that the stuffing is pulled out. There's a big puncture wound from where this dog has got him. I hate to think the amount of damage that would have been done if he was just in a T-shirt or something. It'd probably be a very different story.
Oh, boop. Look at you go. How brave are you?
Eamon is now checking Leo's oxygen levels, blood pressure and heart rate to look for any signs of internal bleeding.
Can you see all the flashing dots there? That's all about you. Sats are good. Let's let him settle with a bit of fentanyl. All right. I'm going to give you some special medicine, okay? See, look at this one. It's magic. Ready? No, you watch. Ready? Here we go. Ready?
Oh, look at that.
Look at that. Can you feel it? It feels like rain.
What did it do?
It makes you feel better. All right, ready? It's okay. It's okay.
Leo's hysterical at the moment. He's so difficult to assess. I don't know how deep this bite has gone into Leo. I don't know if he has any fractures. He's got huge potential to get an infection from this bite. And then he's got the emotional trauma, the mental trauma from this. He may never be able to approach a dog ever again in his life.
Leo, it's okay.
So painful.
I know. So the more painful it is, the more I want you to focus on taking deep breaths in through the mouth.
Michelle and her partner Nate were trying to have a romantic night in a hotel, but it's ended in disaster.
Trying to get her at least to just out of the water, yeah.
Michelle has fallen over in the pool and has an horrendous fracture of her right leg.
I am getting another crew for help, okay?
Yes, lovely, thank you.
Because I really think this is going to be a long extrication.
Penthrain, also known as the green whistle, and intranasal ketamine are being given, but there are complications.
So it's really important for me to treat Michelle's pain, but at the same time, it's a really delicate balance because I don't want to give her so much pain relief that she goes unconscious. At the end of the day, I need her help to get out of the swimming pool as well.
We're not going to rush this, okay? We're going to do it slowly. We're going to get you comfortable. The last thing we want to do is cause more pain.
Michelle's leg needs to be splintered as soon as possible, but working in this confined space is a massive challenge.
You're doing good now. You're breathing on it well.
As soon as the pain relief takes effect, Leonard gets everyone ready for the difficult transfer.
Breathe, breathe, breathe. Breathe, breathe,
Well
breathe.
done.
Hold her foot.
Keep breathing.
Hold her foot. Hold her foot.
Keep breathing, keep breathing,
Hold her
keep
foot.
breathing.
Well done.
Well done,
Deep breath.
well done, well done. Gonna lie down, well done. With that type of pain, I reckon ketamine, straight up.
It's an obvious deformity. Yes, we're going to.
Significant fractures of the lower leg can lead to a lot of complications. It can lead to permanent nerve damage, a lack of blood supply. People can be left with permanent disability from even a fracture.
Take a deep breath.
We will attempt to irrigate, and then we will transport.
No dramas, mate.
5-year-old Leo has been attacked by a dog.
All right, we've got to fix it.
Despite pain relief already being given, Leo is still distressed. But his bite wounds have to be cleaned to prevent serious infection.
Securing a dressing is going to be troublesome.
Yeah, I reckon just irrigate, mate.
Yeah, I think we've irrigated as best.
Yeah, because it's not hemorrhaging.
Yeah. Leo, it's okay.
I'm looking at Leo's face and his lips are starting to tremble. He's starting to shake. He's really scared. He's absolutely traumatised.
And Mummy's sitting just behind you. We're good to go, mate. Roger, moving off. And we're gonna go see the doctors and the nurses. Good job. You're so brave. Do you want to see a magic trick, Leo? This is probably my best ever magic trick, okay?
The trick to any great magic trick is you've got to have some theatre about it. You've got to build it up. So I'm setting Leo up.
I haven't even shown Mike this one yet.
I can see, he's ready to have his mind blown.
Ready? You have to sprinkle some magic dust on the bit of paper. So we sprinkle, sprinkle, sprinkle. You got to put some on. You got to sprinkle it on, otherwise it won't disappear. Ooh, too much. Just a bit much.
And finally, I hit the penultimate moment of this magic trick.
1, 2, 3. Where'd it go? Oh. Wow. Was that good? Tough crowd.
Tough crowd. How'd he do it?
And nothing. Leo just looks at me like I am the village idiot. He's thinking, don't quit your day job, just get me to a hospital and be quiet.
What's your favourite animal? You like a cat? I like cats too, you know. I don't have a cat. I have a dog.
What's the dog's name?
My dog's name's Walter. He's a very nice dog. Do you want to see a picture of him? No, that's okay. That's fair enough. Dogs are a bit on the nose at the moment. Hey, Leo, we're at the hospital, and you get to come in on our special bed because you're our special patient today. Hi, Mum. Good job.
Here we go. Mum's right here. You've been such a big, brave boy. Woohoo! And you watched Eamon's magic trick, which he loves.
That was my best magic trick yet.
I know that there's a potential Leo might need surgery and he might even need plastic surgery. So an innocent trip to the playground for Leo has potentially huge consequences for the rest of his life.
Mum is right here. There she is.
How are you feeling, Mary? Do you feel more confused than normal?
Steve and Emily are becoming increasingly worried about the confused state of 83-year-old Mary. The elderly nun has already suffered one stroke a few months ago and could now be having another.
This is not normal for her at all, is it, to be speaking like this?
No.
Because she's answering questions appropriately, but it's like she can't express herself.
That's right.
At some points.
Sister Joan is fearing the worst for her best friend.
So, Mary, Richard's just going to do a little assessment on you.
If you just look at me, that's all right. Give me a big smile. Show me your teeth.
So what we're looking for is, does she have any facial droop? Is her speech slurred?
Now with your hands reach up and grab hold of my fingers.
And are her grips strong bilaterally?
That's it. Give them a nice tight squeeze for me. And your sensations here, does it feel the same on both sides?
Yes.
Yeah. Okay, good. That looks good.
Good news is that we don't think Sister Mary is having a stroke today, but we still have to get to the bottom of this problem.
We're just going to pop these dots on. Have a look at what your heart's doing.
You have a temperature of 37.8.
So Mary's heart rate's good, her blood pressure's good, her sugars are good, but Mary's got a temperature. So what I'm thinking is that Mary has an infection somewhere.
Have you got any wounds or anything that could be infected?
No.
Okay. Do you have any pain while going to the toilet or anything? Have you had a UTI before?
Have I had?
Urinary tract infection before?
Yes. Haven't you, Mary?
She has? Yeah.
Yes.
We'll have to take you up to hospital for investigation. How does that sound?
Okay, that's fine. I'll come with you.
So worst case scenario here is if left untreated, Mary gets this UTI that then goes into her bloodstream and she becomes septic from this.
Alrighty, Mary. Let's go.
Sepsis is an infection that can kill you.
Are you right, darling? Slow and steady wins the race. Breath. Take a deep breath.
On a romantic night away, 38-year-old Michelle has fallen in the hotel pool, fracturing her leg in several places.
Yep, keep going, love. Okay, heart rate's 84.
Yeah.
So that's a 99%.
Nat and Leonard are giving Michelle strong pain relief before the ordeal of moving her to the ambulance 19 floors below.
3, 2, 1.
Oh. Yeah.
There we go.
Good stuff. You guys here on holiday or?
Yeah, we were.
For the night?
For the night, one night.
Just
This happened.
arrived, did you?
Goodness me.
My heart absolutely goes out to Michelle and Nathan. They're just trying to enjoy one romantic evening away, and then this happens. I really feel for them.
What are you worried about, Michelle?
I'm a mother of two special needs children.
Oh.
And I just wish it didn't happen to me.
Oh. Look, it's an accident and it's a bit unlucky, isn't it? But this won't define your life. And
I was on a weekend away.
Oh.
Sorry, babe.
Poor Michelle, she's a working mother with two special needs kids. I can understand that she's genuinely concerned. Who's going to look after the kids? Who's going to help her? We as mums just don't have time to get injured.
I'm going to have a bit of a feel of your leg.
Michelle's fracture is now being assessed before splinting can begin.
Can you feel if I'm touching your toes?
Yeah.
You can feel that, okay. Can you wiggle your toes? Beautiful. She's got good sensation and we've got good movement of the toes. So in terms of neurovascular status, it's good.
Okay. Sharp sting coming up.
A splint is needed to realign Michelle's bones before getting her on the stretcher.
Okay, deep breaths for me,
Really
Michelle.
deep breaths.
Okay. Okay.
Keep breathing on that, Michelle.
I reckon down.
Go down, down.
Down, down, down. I think just for a minute.
We're going to give you a bit more pain relief, Michelle.
Yeah.
You're doing really well.
It's really important to get Michelle to hospital quickly. At the end of the day, she needs to get those bones surgically repaired so that she can have a short recovery time and get back to her kids.
Deep breaths.
At the Essendon Air Base, intensive care flight paramedic Matt is on his way to a frightening road accident 180 kilometres from Melbourne in the Victorian High Country.
M5 to Westeros. Any AV crews arrived at scene yet?
Negative, not as yet. However, Bridge Creek don't look too far off now.
Are there any reports on the second patient?
Negative, no reports on the second person involved at all.
Two motorbikes have collided and one of the riders is seriously injured.
I don't know why people ride motorbikes. I understand it can be exhilarating, but at the end of the day, you are very vulnerable. You come off a motorbike and there's not an awful lot to protect you.
There's a big sports oval right near it, man.
Is that?
It's good. The campus crew's been in there before.
He has the potential to have a head injury, he has the potential for a neck injury, plus other injuries going on throughout the rest of the body.
Clear the pencil on that, yeah, Cletus. To ground left.
As the air ambulance team prepares for landing, local paramedics have now arrived at the accident site. One rider has been cleared of injury, but there are serious concerns for off-duty firefighter Bruce, who is still lying on the road.
Hey, mate. How you going?
As we arrived, my concerns increased dramatically. The immediate thing that goes through my head is, why hasn't he got up? Why hasn't he moved?
Got a 59-year-old fella here.
Yep.
He was travelling 60 kilometres an hour.
Yep.
He's been head-on into another bike.
I start thinking, has he got a spinal problem? Has he got severe fractures? Maybe he's got internal bleeding. So my apprehension and concerns for him at this point are heightened.
If you can sit down, just pop your bottom down. Perfect.
83-year-old nun Mary has a fever and is very confused. Steve and Emily are worried she may be suffering a urinary tract infection.
I am ready to go.
While UTIs are common, in the elderly, they can be very dangerous.
In the worst case scenario, UTIs can lead to a blood infection, and then the blood infection can lead to death. It's actually quite shocking what a UTI can do to you.
So you're both nuns?
At the convent?
Yeah.
Yes, I entered there before you were born in 1952.
Mary's longtime friend, Sister Joan, is on board for support.
Are you allowed to get married?
No.
No.
We take a vow to remain single so that we can look after anyone and everyone.
Okay. Are you in celibacy as well?
Yes.
Okay. What a huge commitment to make.
Maybe I can be 6 months celibate, and that's about it. That's where I draw the line in the sand.
I worked in the men's prison in Queensland.
Ah, okay.
And Then I did 2 years missionary work in Thailand, working with women caught up in prostitution.
Okay.
And Mary worked for nearly 40 years with women prisoners.
Oh, wow. That's fantastic.
Yeah.
But I loved it.
Definitely rewarding work.
Yes.
Been a great life, hasn't it, Mary?
Yes.
Yeah.
These women are incredible. Listening to Mary and Joan's story about how much they've conquered and done together is amazing. I just sit there in awe and go, tell me more.
You're so good, all of you. I don't know what we'd do without you.
Oh, thanks, Joan.
Yeah, no, you're marvellous.
No, Emily's the good one.
She's good.
Yeah.
So are you.
I'm the wicked one.
I don't think so.
How you feeling, darling? Now, normally when you'd have a conversation with Mary, Joan, it's like back and forth like we're having?
Yes.
Yeah, so she seems a lot more slower than usual, would you say?
Yes.
Yeah.
Fortunately, the team are now arriving at hospital where doctors are waiting to assess Mary.
We'll get you on out, we'll get you to see a doctor and hopefully sort out today's problem. My hope for Mary is that she doesn't have a sepsis. She's such a beautiful woman. I would hate for anything to happen to her. Joan, just follow us.
Thanks, Steve, for your treasure.
Hopefully, she's going to be okay. Mary was just so beautiful.
Yeah, they were both lovely.
I know. What about the bombshell of celibacy? I just can't believe that's how it works.
There's absolutely no way that Steve would ever make it as a nun. He's looked really good in a habit, though.
That is too funny.
How's that pain going?
I actually don't want to move my leg.
Righto.
In Victoria's high country, 59-year-old Bruce has been on a week-long motorbike holiday with his mates.
Where are you sore at the moment, Bruce?
It's like I've just had a massive football cork right down the side.
So when you bend the knee up, is it causing any pain anywhere at all or not? Just in the hip? No worries.
But the good times for the man, nicknamed Simo, have ended in a terrifying collision with another motorcycle crashing into his right side at 60 kilometres per hour.
We'll get you off all this stuff in a moment and into the helicopter and on the way back down to Melbourne to get you checked out. The damage to Bruce's motorbike is actually quite minimal, which increases my concern because if his bike hasn't been damaged all that much, that means that Bruce has essentially copped most of the impact from the other bike coming the opposite direction. So we're going to roll you onto your back, mate. A little bit of discomfort as we do that. Ready, set and go. That apprehension and that pain that you must feel as that big chunk of metal and steel actually ploughs into you must be immense.
Bruce's longtime mate Jeff was riding behind him and witnessed the near-fatal impact.
There was a slight bend and there was this bike just coming straight for Simo.
We'll just grab a few sets of hands to lift him.
You can't really believe that's happening. What's he doing? And bang, straight into him. He hit it with such force that it exploded like there was a grenade inside it. I couldn't believe it.
Nice, you know.
Thanks, Jeffrey. Lots of love and support from you, mates.
Oh, yeah, mate.
20 years I've known Simo. This is not the first time I've seen this happen. Actually, I've lost a couple of mates who died at the scene. Then I realised Simo's in trouble.
So a little bit of discomfort and pressure as I put this on.
Bruce has already been given pain relief, so flight paramedic Matt can start his examination and find out just how much damage the massive motorcycle impact has done.
Bruce, give your toes a wiggle. How's your sensation in your feet, mate? At the moment when I assess Bruce, I can't see any obvious deformities or any obvious fractures occurring. A couple of big breaths for me there, Bruce. But that doesn't mean that he hasn't got things underlying that I can't actually see just by looking at him. So there could be internal bleeding, he could have cracked ribs, so we need to transport him to the Royal Melbourne Hospital.
You right?
Okay, are we all ready?
Yeah.
Right, let's hit number one, yep.
High up on a rooftop hotel, Nat and Leonard have just finished splinting Michelle's horrendous leg fracture.
Once we get up high enough, we're going to get the stair chair right across in here and then get it to shuffle across it, all right?
The mother of two special needs kids was having a rare night away with her partner Nate when she fell in the pool with disastrous consequences.
Michelle, open your eyes. Can you see me? Hello. You're good.
A second paramedic team has been called in as backup to help move Michelle to the ambulance 19 floors below.
Right, push down on your good leg and move that bottom over. Yes?
Well done, well done.
Oh, amazing.
Unbelievable
Put
job.
the good leg up. Awesome. No? Okay.
If you've got
okay.
the pain, keep breathing. Where's that green?
Here we
Where's
go.
the
Pop it in your
mastocyte?
mouth. Leonard, let's start rolling forward a bit.
Yep.
We're used to going to traumatic jobs and seeing blood and guts,
Gonna be a bit bumpy, Michelle.
but something about a broken leg moving like this, it just makes me cringe.
We're doing one more movement and that's it, and then you're done. You're gonna push down on the good leg and move your bottom over. Yes.
Well done.
Okay, good leg up. Excellent.
Absolute
Done.
champion.
Okay. Whew, we got there.
Nat and Leonard can now take Michelle to the ambulance and start heading to hospital where she'll need urgent surgery.
I'm worried Michelle has broken both the bones in her lower leg. There's potential internal bleeding going on, and has she cut off blood supply to her foot? Oh, it's bad.
How you going there, Michelle? You're a trooper.
Gonna be a bit bumpy again, Bruce. He is sore on the right sides.
Motorcycle accident victim Bruce is about to be emergency airlifted 180 kilometres to the Royal Melbourne Hospital.
Bruce, just as we did before, mate, we're going to roll you on your side in just a tick.
The off-duty firefighter was on holidays with friends when he collided with another motorbike.
On go, ready, set, and go. And back, ready, set, and go. Much pain when you do that, mate?
No.
When Bruce tells me he's not feeling any pain, I imagine the impact and how sore he must really be feeling down that side. And I know he's lying to me. Small bumps as we get you in here, mate.
You right, Brucey? Yep.
Good man. Bruce, how's that pain going at the moment now you're resting there?
Oh, yeah.
You feel it, don't you?
I feel it.
Yeah. And no past medical history. You don't take any medicines. You got no allergies. Normally fit, well and active for a man of your age.
Try to be.
Yeah.
He's only 50.
60.
60, eh?
No, 59.
59, that might be.
Yeah, sorry, I'm not going to make him 60 yet.
Still on the good side.
I've got my 50th this year, so...
Oh, that's not a bad one.
Yeah, I'm planning to have a few lagers on that night.
He's done it hard. I thought you were only 40.
Thanks, mate.
Lived his life down the gravel road.
Yeah. Turning 50, I look at it and I go, how the hell and where did all those years go? Like, I remember joining the ambulance service at around 28 years of age and always looking up to the senior people thinking, gosh, they've been in the job a long time. And all of a sudden, here I am as a 22-year veteran in the job, turning 50 years of age.
And Clinton, up we come.
I'd never change my mind about my career. I have the best job in the world. I work with some of the most amazing, caring and passionate people that you could ever come across. Every day that I go to work, I do something different.
Bruce, can you hear me okay? Good man. Pain still okay? Comfortable, nice and sleepy?
I enjoy looking after people and providing care to them. I wouldn't change anything about it. 50's the new 20.
Just going to have a scan of your belly, okay? Bruce, take a big breath for me. Excellent. Nose and out. Good man.
Ultimately, the ultrasound will give us an indication whether there's been any internal bleeding, whether any of his organs have taken an impact. He has a large potential to have injury to his liver or to his kidneys.
Bruce, I'm just going to move your arm just out the way just for a tick, mate. So we can get to your side here. That looks good.
So far, Bruce does not appear to have any life-threatening internal bleeding, but he will be fully investigated at the trauma centre.
G'day, Bruce. Good man, mate. And just as we come into land, there's a bit of vibration that goes through the aircraft. That is normal, okay?
Given the accident that Bruce has been involved in, every part of his body is going to be sore and he's going to be feeling every single bump that we go over.
And 5's on the Pat Royal Melbourne Hospital.
That's it. Nice and breezy up there for you, Bruce.
It's all right, mate.
You've come out of it very well, Bruce. That's the main thing.
I think I'm very lucky, mate.
Bruce is just a perfect patient. He's a very stoic man. But although he doesn't display a lot of things at the moment, bruises don't turn purple and blue straight away. They take a couple of days to develop. And I imagine in 2 days' time, Bruce is going to be quite colourful down the right-hand side of the body. More than likely that he's got a couple of broken ribs or maybe a broken bone down that side of his body as well. That's the worst of it, Bruce.
Good on you, guys.
I'm heartbroken.
Heartbroken?
We went up on our first drinks to have on the balcony later. It would have been so lovely.
As dusk starts to fall over Melbourne, reality is beginning to sink in for mum of two, Michelle.
Well done.
Well done.
Deep breath.
Well done. Well done.
Oh.
Gonna lie down.
The 38-year-old mum has just broken her leg in a hotel swimming pool.
Leonard, are you good to go?
I'm happy to slowly roll off.
Luckily, we're close.
So you've got 2 kids that you said. How old are they?
8 and 11.
8 and 11, and both are special needs?
Yes.
Oh, wow. So you really are super mum.
They call me Wonder Woman.
No doubt. I mean, I've got 1 kid, and hats off to, you know, anyone who's got more than that. And you've got 2 kids who need that a little bit of extra help.
Absolutely, yeah.
Well, she's got the red bathers as well.
Yeah.
That's what Wonder Woman wears,
Yes,
isn't it?
She wears red.
Michelle has done such a wonderful job, and I can see that she's got a Wonder Woman tattoo, and she's certainly being one of those today.
We are here.
It was a short trip.
I hate that it happened like this.
You're Wonder Woman. You're going to get over this.
Absolutely.
Now we're at hospital, she'll go straight in and likely end up in surgery today.
We're just going to lower the stretcher.
Okay. We are at hospital. Look at that.
This is not just a fracture. This broken bone is going to impact Michelle significantly. She's going to have a really long recovery time. She's going to have to go through rehabilitation. It's a long road ahead, and she's going to need all the help that she can get.
What a job. I mean, that just took forever, didn't it?
Yeah, that was epic. Poor thing, when she moved her leg, you could see that the foot, it looked like it wasn't even attached.
No, you could feel her pain.
Oh, agony.
What about that view? Did you take a second to take it in? Just
I
a
did.
split second?
I had a look at the view, I checked out the infinity pool,
Yeah.
and then my focus was completely on Michelle.
I looked at the view, thought it was beautiful, and I got a little bit scared as well because I've got a bit of a thing with eyes.
So do I.
Yeah,
So do I.
Yeah.
And we were up high, weren't we?
Very.
I know. It was like, don't look down, don't look down, don't look down. Can you imagine? The 2 of us are like, can't do it, can't do it.
Yeah.
Too scared.
Oh, it was a good job.
Leo, you're okay, mate.
It's been 4 weeks since little Leo was attacked by a German Shepherd at a playground.
Got abrasion here, puncture wound there.
The 5-year-old was traumatised and at hospital had to undergo major surgery and skin grafts to repair the damage.
It's okay. It's okay.
Leo's parents have contacted the local council about the frightening incident, but it appears the owner of the dog gave fake details and cannot be found.
Mum is right here.
How are you feeling, Mary?
Tests confirmed 83-year-old Sister Mary was suffering a serious urinary tract infection. She was treated in hospital with antibiotics and has made a full recovery.
Beautiful.
Where are you sore at the moment, Bruce?
It's like I've just had a massive football corky right down the side.
Firefighter Bruce was on a holiday with mates when another motorbike crashed into him doing 60 kilometres per hour.
How's that pain going with that movement and stuff at the moment?
I actually don't want to move my leg.
Righto.
The 59-year-old was off work for a month, suffering cracked ribs and nerve damage down his right side.
How's your leg going?
Oh, same, mate. It's on the mend, though.
Today, his riding buddy Jeff, who witnessed the near-fatal collision, is checking up on Bruce's recovery.
Limping a bit still?
Yeah, I have a bit of trouble sort of bearing weight on it a lot. At the time, there's a lot of bravado and I'm fine, it's all good, but you actually start to think about it about a week later, what could have been. I didn't realise I actually copped it right in the face.
That's where you've hit the ground first. Your head's gone crack onto the ground.
Yeah.
And then this wasn't down, you would have worn your face on the road.
Pays to have something that protects you, doesn't it?
Oh, mate.
There was a stage there where it would be every 5 minutes I'd be thinking about the process of what took place, having visions of the bike coming towards me and having memories of actually bouncing along the road. Yeah, look, I don't know when I'm going to get back on the bike.
Oh, soon?
I hope so.
Oh, mate. Soon, you've got to do it soon.
It's certainly one of the biggest scares I've had in my life. I consider myself extremely lucky not to have any other major injuries.
It's good therapy for you to ride the bike.
Well, I think
Absolutely.
I need to, yeah, eventually.
Meanwhile, the other rider in the collision has been fined for failing to keep left.
How bad's the pain?
Oh my God. 10?
10?
10 out of 10.
Yeah.
38-year-old Michelle's romantic night at a hotel with her partner Nate was ruined after a disastrous fall in the rooftop pool.
Well done.
Well done.
Deep breath.
Well done. Well done.
Oh.
And lie down.
At hospital, doctors discovered her right leg was broken in 4 places. A metal rod was inserted and Michelle couldn't walk or drive for 6 weeks.
My life revolves around my children, Kiana and Caden. They both have been diagnosed with autism. I was very worried that my accident would hinder the needs of my kids. How am I going to be getting them to school? How am I going to be taking them to their therapies? When they first seen my broken leg, Caden, the older one, he just burst into tears and he started panicking, and it was pretty much a meltdown moment for him. Since that, I've focused on turning it into a positive and saying, no, we're going to learn from this. We're going to see how quickly I can get back on my feet. And I've kind of taught him that, a little bit of resilience.
Yes.
Well done.
Okay, good leg up. Excellent.
Absolute
Done.
champion.
I am so thankful to those paramedics who attended on the day. They were so attentive and they were just so lovely to have by my side in one of the worst moments of my life.